In this video, we're going to talk a little bit about shifting your weight while seated. So we're looking at a pelvis here, and there are two bones, which are the bony parts of your butt. We refer to them as your sit bones. So you have a left sit bone and a right sit bone. If someone has a tendency to shift more frequently to one side, they'll tend to have a better sense of the sit bone on one side than the other. So when we're sitting, we want to have contact on both sit bones at all times, and we also want the ability to be able to shift weight into one sit bone as we desire. So if you're unable to shift weight into one sit bone, this is definitely something for you to work on. Or if you're someone that has a tendency to shift most of your weight into one sit bone, you might want to practice the other side to balance things out. And so what you'll typically see, if you're someone that tends to over-reference one sit bone relative to the other, is that you'll drop the shoulder on that side, and as you drop the shoulder on that side, your center of mass shifts over towards that side, and you're going to feel a little bit more pressure on the sit bone on that side. And so that can lead to all sorts of things like a tight right chest wall and tight right ab wall in this case, okay, and then neck issues on one or both sides. So if that's you, what you want to be able to do is you want to be able to bring this left shoulder down and then shift your center of mass over to the left in this case, so that you have a little bit more pressure in that left sit bone. And throughout the day, you want to vary that up, so you can spend a little bit of time like this and a little bit of time like this, because the position you get stuck in is the worst position, okay? You want to be able to do both. If you can do both, you're going to feel better, and you're going to maintain your movement options in the rib cage, abdominals, and neck.